So who's a good candidate for Sculptra?
There's a pretty broad class of patients that are good candidates for Sculptra. I have been injecting the product for 2 decades, and my youngest patient has been in their late 20s. My eldest patient is well into their 8th decade, and I think that speaks to the power of this product. We want to make sure that they don't have a contraindication. Somebody who has a history of hypertrophic scarring, like keloids, or if they have an autoimmune condition, we don't want to do collagen stimulators such as Radiesse and Sculptra. It can cause an inflammatory response that's unintended. There are relative contraindications, so we try and time things appropriately. So if people are doing major dental work, if they're having vaccinations such as their COVID vaccine or their flu vaccine, we don't want to inject collagen stimulators right around that time. During that time, they have an intense immune response, and we don't want to create too much of that synergy at one time. Most candidates are those that need volume replacement or have noticed skin textural changes, whether it's the face or the body. So both Radiesse as well as Sculptra can be used on the face, and off-label, we've used it on the body for a long time to help rejuvenate the chest area for vertical lines, the arm area for crepey skin and volume loss. For women after postpartum, if they've got skin laxity in the abdominal area, both of these products are excellent for that. And we can use it in the buttock, thigh, and knee region to help support healthy tissues or even volumization. We really formulate it differently. If we're trying to create volume, we use it in a more concentrated manner. If we're trying to affect skin texture, we use it in a more hyperdilute manner. But it's always completed as a series of treatments, and there's some level of maintenance involved. So I do think good candidates have to be okay with delayed gratification and some level of maintenance. This isn't a one and done procedures, and really anything in cosmetics, I think, is not a one and done procedure. So I think keeping that in mind, being okay with having to see results over about 6 months, making sure they don't have a contraindication, and expecting healthier skin that's gradual but meaningful over time is my expectation with collagen stimulators.